We normally focus our technical support in relation to WHO's efforts to work with member states on evidence-informed policymaking, and often specifically focus on EVIPNet, evidence-informed policy networks. But when COVID hit, we pivoted very quickly and created a new entity called COVID-N, the COVID-19 Evidence Network to support decision-making. We brought together 57 world-leading evidence synthesis, technology assessment guideline groups from around the globe, many drawn from the region, and really invested heavily on one intervention on the policy demand side for evidence, the COVID-N inventory. It's all the best evidence syntheses in the world about COVID-19 response. And then on the evidence supply side, we put together a horizon scanning panel to find emerging issues, developed a COVID-N community so people could learn from one another, and developed a number of resources for groups that were bringing evidence to bear to support decision-making related to COVID-19. So it's been a great chance to pivot and do work directly supporting COVID-19 decision-making in member states. If I had to pick a specific single contribution that we've made during COVID-19, the WHO Collaborating Center for Evidence-Informed Policymaking through COVID-N created this initiative called the COVID-N Inventory. So we have now assessed well over 10,000 evidence syntheses about all aspects of COVID-19, public health measures, clinical management, health system arrangements, and broader economic and social responses, rated them all for the recency of the search for evidence, the quality of the review, the availability of a great evidence profile, and we only provide the best synthesis for any given COVID-19 decision. So we've reduced the noise to signal ratio from 10,000 plus evidence syntheses down to only the top 500 that best meet the needs of decision makers. In terms of the lessons learned, I'd say we desperately need to systematize what went well with the COVID-19 evidence response, the inventory being one of them, and address the many things that didn't go well. Some of the things that went well: amazing demand from policymakers for evidence, amazing responsiveness from the evidence community. What went poorly, I'd say three things: limited global coordination, huge amounts of unnecessary duplication in the evidence being prepared. Second, some types of evidence dominated, like modeling, when we really need a balance among many different types of evidence. And the third, some other things dominated evidence. So lots of attention to expert opinion that wasn't backed up by evidence, lots of traditional uses of single studies, often preprints that hadn't been rated for quality. But again, we've learned lots of lessons, and I think we can do much, much better in the future. Our experience being a WHO collaborating center has really been superb, and I would really attribute that to very close collaborative working relationships that we have with WHO staff, and that includes people within the Pan American Health Organization or the Americas Regional Office of WHO, people like Ludovic Revice. Similarly, his counterpart in other regions, people like Arash Rashidian in the Eastern Mediterranean Regional Office, and also at headquarters, people like Tanya Kuchenmuller, who are in charge of EVIPNet or evidence-informed policy networks. It makes such a difference to have people who know the WHO environment, but also are evidence savvy and can identify ways to bring us in ways that we can really optimize our impacts with member states. The major benefit, I'd say, from being a collaborating center is the clear communication that we get about where the need is, which is really helpful. There are so many groups out there wanting to make a difference, but to have a direct pathway to keep people at WHO saying, if you want to help, here's where we need the help, that has been a major, major benefit to us. We really haven't had, I wouldn't say, any major challenges. I would just say that while we have these great direct paths to individuals at headquarters and in regional offices, if there was any way to strengthen our connections to the many other parts of WHO who need support as well in using evidence in their technical work, then that would be ideal. Well, I think from a Canadian perspective, and maybe I'll speak a little bit parochially, these WHO connections have allowed us to provide even greater value here in Canada. So we run a rapid evidence service for Canadian decision makers where we provide the best evidence in anywhere from 1 to 10 days, depending on the nature of the request. And because of the COVID and inventory, we're able to get the best global evidence, but our connections to WHO have meant we've also been able to bring insights from our partners around the globe through WHO. And that has really helped Canadian decision makers. And then reciprocally, because we have very close relationships with many other member states in the region, we have been directly working with colleagues in many, many countries in the Caribbean, throughout Latin America, to support their use of evidence to address COVID-19 challenges. So it's been a win-win. We've brought the benefits of WHO, we think, to Canada. We've also brought some of the insights from Canada to our other partners in the region. So again, a lovely win-win.